Tutorial number 7, Slings. In this tutorial you will learn what a triangular bandage is, different types of sling, how to apply a sling depending on the injury, and what to do once the sling is applied. Welcome to the LARPE tutorial. This tutorial is about bandages, and in this instance we're going to talk about the triangular bandage which you'll find in your kit. When you open your triangular bandage, you'll see the reason for the name of it. It's actually a triangle in shape. Okay. One long end and a square-ended point. Now in this instance we're going to be using this to make sling. There are two types of sling. The first type of sling is an arm sling, and this is often used for comfort purposes for the patient. The patient may have broken their arm, they may be suffering an injury, they may need just to hold it in place. This also indicates to any other people who are in the area that the person's injured, so they might avoid them, and that gives the person a bit of reassurance. So here's my patient. Can you please put your arm across as if you've injured your arm? This normally would be bandaged. Obviously for this purpose we haven't done this. So first you take the point, and the general rule is point to the elbow. So you place this part of the bandage under the arm, point to the elbow. Hold this part across and you take it to the back. Where the other one meets, you then take the bandage and you make a reef knot. It's good to do it a bit tight, but not too tight. And if the person who's having the sling put on them is finding it a bit uncomfortable, you can often put a pressure pad underneath that to stop them from getting sores. Once you've tied the knot securely, now it's time to tidy it up. Moving the arm very carefully, make sure that the fingers are sticking out of the end. Now this is important because then you can check on circulation. If the bandage is too tight, it gives you a chance to adjust it. You should do this every 10 minutes. Finally, you tidy your bandage. At the elbow where the point is, 1, 2 very firm twists and tuck it into the end. Now you can use pins, people have been known to use pins, but I wouldn't advise that because obviously the pin could come undone and could jab into the person. So there we have the arm sling. Slings. To recap, there are two types of arm sling. The arm sling, used for comfort and to keep an injury in a stable position, or an elevated sling, used for collar or cuff injuries and wounds. When applying a sling, always ensure the patient is comfortable. If the patient is able, ask them to help you hold the sling while you secure it in place. A reef knot is best when securing the sling. When the sling is applied, check for circulation. This should take place every 10 minutes or so. Reapply or loosen the bandage if it is too tight. The second type of sling that I want to speak to you about is the elevated sling, and this is used for collar injuries or wounds where the arm needs to be elevated out of the way. This is slightly different to the previous arm sling, in whereas the arm goes across, the long end is placed above rather than below in the other sling. It follows the arm. You can ask the patient to hold that for you. It comes around the back as before and meets up at the back, and a reef knot ties the two together. Again, padding can be used to support. This then gets tucked underneath, and you can use tape to secure the bandage here. Is that right? Yeah. Again with the arms, the fingers again, just to check that the circulation is going through the fingers. If that stops, then you would suggest to undo the bandage and start again and loosen the bandage. Slings. To recap again, there are two types of arm sling. There's the arm sling and the elevated sling. When applying a sling, always ensure the patient is comfortable. If the patient is able, ask them to hold the sling while you secure it in place. A reef knot is always best when securing the sling. When the sling is applied, check for circulation. This should take place every 10 minutes. Reapply or loosen the bandage if it is too tight. Slings. Are you ready to take a quick quiz on what you've just learned? Follow the link below. Good luck.